Greetings and welcome to the segment 2 of our 7-segment presentation on menopause. In the previous segment, we discussed the signs and symptoms of menopause, which can be summarized as the ones appearing on the screen. In this segment, which is segment 2, we will talk about the effect of menopause on bony skeleton. The bony skeleton is a frame on which our flesh hangs and need to be looked after very well. There are 3 things that a person in menopause should do in order to keep the integrity of a bony skeleton. 1, he should engage in physical activities. By physical activity, I'm referring to normal household duties that you usually do in your house, like cleaning your house, washing dishes, washing your clothes, and walking to the nearby shop. Please avoid taking a car when you go to a distance which you can walk and come back, because it's these short distance walks that keeps the bones strong and fit. Because during menopause, due to lack of estrogen, your bones go into a stage called osteoporosis. Osteoporosis means the bones that have got holes, the porous bone. Looking at this 100-year-old lady, she's doing what she knows the best, which is roto. It keeps her bones fit and appropriate for her age. One cannot avoid menopause. One cannot avoid going old. But your strength of your bone must be appropriate for your age. As such, at menopause, the type of activities that you get involved must be appropriate for your age. Stop jumping from heights, doing things that you used to do when you are young, because that might keep a lot of strain on your bones. Looking here is the bones, the axial skeleton, which is grossly affected by menopause, and part of the appendicular skeleton, which are so affected by menopause, which is the hand and the hip. The fractures that happens during menopause because of the weak bones of osteoporosis, they usually happen on the spine, on the wrist, and on the hip joint. Looking at the bone here, you see a compact normal bone and the slide of an osteoporotic bone. As the definition says, osteoporosis comes from the word osteum, which means bone, and porous means hole, which means the bone with a lot of holes in it. Such bone is a spongy bone which is brittle and fractures very easily. Throughout our life, our body keeps on forming new bones, and the old bone gets resorbed. If the process of bone formation versus bone resorption, the process of bone formation becomes less than bone resorption, then more bones are resorbed than are formed. Hence, we go into a stage of osteoporosis. That is why it's important for one to, when she enters menopause, to take hormone replacement therapy together with calcium, because you need calcium in bone formation. The hormones need calcium to form new bones. Let's discuss the fracture of the neck of femur. This is the worst fracture that can happen to a menopausal woman, because a woman with a fracture of neck of femur will never walk or stand up for the rest of her life. The reason being that as the bones are osteoporotic, it is difficult to treat this fracture. In a normal young person, if she sustained a neck of femur fracture, the treatment will be to put a prosthesis, a head of femur prosthesis. But an osteoporotic bone cannot hold a prosthesis, cannot hold an artificial hip. So if this woman with osteoporotic bone sustained fracture of the hip or neck of femur, it means that woman will never be able to stand up or walk for the rest of her life. And that's what makes them die early. Because they don't die from the fracture, but they die from other complications of fracture, like bed sores, deep venous thrombosis, pneumonia. The worst of all is psychological depression. The mere fact that she's unable to walk or stand up puts her in the stage of depression. The osteoporotic bone of the vertebrae is depicted here. Above is a normal bone matrix, below is the osteoporotic one. If the spine has got osteoporosis due to menopause, the vertebrae get squashed between other vertebrae because of your body weight. And if they get squashed, the body tends to curve forward. You bend forward. The process called kyphosis. Let's take you through the process demonstration of vertebral compression fracture.
High-energy trauma from a fall from a height or a car accident can lead to spinal compression fractures. The vertebral body cracks under great pressure. Compression fractures most commonly arise due to severe osteoporosis, a progressive loss of bone mass most often seen in postmenopausal women. The vertebrae become brittle and can collapse even during normal activity, leading to a spinal compression fracture. Another cause of vertebral fractures is a metastatic disease.
Looking here is collapsed vertebra, which bend the spines. The process which I said is kyphosis. Another effect of vertebral compression fracture of menopause is that a person tends to lose the height. I'm sure you realize in the community that the older people tend to be shorter than they used to be. This is how it happens. Looking on the picture here, the person is upright, is premenopausal, and as you start to go into menopause, she starts to develop this kyphotic posture. With the thorax here, she starts to bend and she loses height. As it gets worse, the kyphosis becomes worse. She's developed a hunch at the back of her chest and the height is less. Because of this bending forward, the center of gravity changes and normally she should fall to the front. Then she needs a stick to balance herself. This is because of compression of different vertebrae, more than one vertebrae. Let's look at the skeleton here. On the right is a normal skeleton, upright, and this one is bending forward. As I said, any bone can be affected. In the previous section, we had a person who got affected at the chest. The vertebral body of the vertebra at the chest got compressed. But in this one is the vertebra and the neck. If the neck vertebra become involved into vertebral compression fracture, the persons tend to look just in front of her feet. He can't look forward. And because she is unable to look forward as she walks, she is prone to other injuries because of this compression fracture. So it's important that we should look after our bones and manage menopause appropriately in order to avoid these calamities of menopause. Thank you.